Hi, my name is Winifred O'Connell, and after taking the personal strengths assessment, I rated 3 of the categories as my greatest strength, my greatest challenge, and one that lies right in the middle. My greatest strength I rated as professional commitment. My middle category I rated as advocacy, and the one that I struggle with most I rated was self care. Unfortunately, for me, self care is not something that I tend to do well at. I am a mother of 2 and a stepmother of 2, and my fiance is a firefighter. So, personally, at home, life can get a little hectic. And then at work, I'm an early childhood educator, and so caring for all of the families and the children in the facility, as well as all of the teachers in the facility, can lead to burnout very quickly. So I rated this skill as I did. I rated this skill as my lowest because that is something that I tend to struggle with on a regular basis. This skill helps health professionals because if you are burnt out in your career, then it starts to take a toll on everybody around you. When I am feeling burnout personally, I tend to not do my best work. I tend to not do as good of a job as I could be because I'm exhausted and I'm tired and I've done all of these things yesterday and I'm coming in to do all of these things again today. And it can take a toll on you, and you can get worn out very quickly. It's very important to take some time for self-care and to take some time for yourself. This skill is something that everybody needs. Everybody could use to work on it. For me, after I've been burning the candle at both ends, I really just need to catch up on some sleep. So, in order to develop the skill further as I progress professionally, is the first thing I'm going to try to do is try to get more sleep. I think that's an area where I struggle with the most. I tend to get 4 to 5 hours of sleep a night all week, and by the end of the week, I'm so exhausted. I'm just running on fumes and running on nothing, and it's very hard to perform at that level. So the only thing that I can do is to continue to try to make time for myself and to do something for myself at least a couple times a week. The skill that I rated in the middle, or at number 5, was advocacy. I rated this skill as number 5 because I do well with advocating. However, I don't really tend to go out of my way for advocating for the children and families. And it's important to promote that social justice and to empower all of the families that we see every day, and to help them to know that somebody is in their corner and that somebody is supporting them. It's important to be there to connect with them and to kind of show them that they're not alone in their struggles, that there's somebody there who can help them, there's somebody there who's fighting for them. And this skill helps health professionals, because when clients see health professionals advocating for them and being there for them and linking them to the resources that they need, it helps them to feel heard and feel like their needs are being met or they're being listened to. And that in itself is extremely important in the healthcare industry, is to feel like your concerns are being addressed. For advocacy, I plan to develop this skill further by finding resources that I can link my families to, and by being out in the community and finding things that can help the families in my care and the children that I care for, and to help them to be there for them and in support of them, and be in their neighborhoods and finding things that I can help advocate for them for. The category that I rated as my highest, as my greatest strength, or my number 10, was professional commitment. I rated this as my number 10 because I have a great commitment to my career and to the facility that I work in currently. I have been at my current facility for more than 10 years, and I've been in the field for at least 15. So I don't plan on going anywhere anytime soon. It requires a commitment forever. It requires your commitment to continuing education. It requires your commitment to learning new tactics and new ways of doing things. And that skill helps healthcare professionals by learning new tactics and new things that they can apply to their job, learning skills of the trade. Things are constantly changing in healthcare, and things are constantly changing in education as well. So staying on top of those things and applying those newly learned skills to your career is very important, and that helps healthcare professionals to provide the best care possible, and educators as well. I plan to continue to develop this skill by being there for my families and continuing to learn as much as I can in the career field and to apply new things and new skill sets to my career and to the children that I work for and care for, to help them to become as successful as they can, and to show up every day and to try my best, I think is very important. So those are the 3 categories that I rated for my personal skills assessment, or my personal strengths assessment. And I hope that I can continue to improve myself in my career as much as possible.